Hello and welcome to today's webinar on photoacoustic and ultrasound imaging to reveal cholesterol-independent vascular effects of PCSK9 inhibition and murine vein grafts. We'll give it a little bit of a minute just to allow people to connect. As you can see, the participant number is going up. Sometimes, typically, when you want to log into a meeting, the computer wants to update something. So let's give it a minute. See, okay, the number starts to stabilize. All right, then we're good. So again, welcome to today's webinar on photoacoustic and ultrasound imaging on murine vein grafts in mice. My name is Dieter. I have the pleasure of being your host today. For the regular viewers, sure you're pretty familiar with this slide about general housekeeping rules that in case, the unfortunate case you have to leave during this webinar, a recording will be made available and shared with you. We'll really love to hear your input, your questions, your feedback on this webinar. But as you will have noticed that your audio and video lines are deactivated, but please use the Q&A button to interact and ask questions anytime throughout the webinar. The presentation will last roughly 40 minutes, plus minus, after which we will then go through all the questions. In case we don't manage to go through them all, rest assured we will follow up with you directly. With that, I'd like to introduce our speaker for this webinar, Dr. Margreet Vries. She is trained in medical biology and is a principal investigator at Leiden University Medical Center and holds a chair at Brigham and Women's Hospital at Harvard Medical School. Her interdisciplinary research really focuses on vascular remodeling and bridging the gap from preclinical to the clinical reality. Well known in the academic field with being on multiple review boards. And with that, I'd like to hand over to Margreet. So if you're ready to share your screen, looking forward to your presentation.
Thank you, Dieter, for this really nice introduction and the opportunity to present our experience with the photoacoustic and ultrasound imaging. And we use this in this study where we looked at PCSK9 inhibition. So a bit of an outline of this webinar. First, I present some background on vein grafts and on PCSK9 inhibition. Then briefly how we do the ultrasound and photoacoustic imaging, and then using our study on the pleiotropic effects of PCSK9 in vein grafts, I want to share with you how we do this ultrasound and photoacoustic imaging. So the most common used conduit for venous bypass is the venous vein. It's used in complex and multivessel cardiovascular disease, either in the heart and in the legs. For peripheral artery disease. So this is challenging on the long term because often these vein grafts fail within 5 to 10 years, and this can be up to 50%, mostly due to a form of accelerated atherosclerosis in these vein grafts. Processes involved in this are remodeling, inflammation, and as I show you today in this webinar on the leaky microvasculature in the vessel walls. So PCSK9 inhibition is a therapy to reduce plasma cholesterol, and one of the it functions as these PCSK9 inhibitors decrease LDL receptor degradation in the lysosomes. So the LDL receptor stays on the cell membrane and can catch the LDL. So besides cholesterol lowering, these PCSK9 inhibition also play roles in have effects on, for instance, macrophages, endothelial cells, and smooth muscle cells, as these recent literature papers have shown. So our hypothesis is that PCSK9 inhibition can pleiotropically prevent vein graft disease. So we start this study with using the UK Biobank. The UK Biobank is a study where 500,000 participants are included from 2006 to 2010. And at the baseline, plasma samples are collected, but also a lot of data as shown here in this graph. And on these plasma samples of these patients, a lot of omics and system biology platforms are used. And in our case, we looked at proteomics. So in this UK Biobank cohort, 50,000 individuals were included, and almost 3,000 plasma proteins were analyzed. After 14 years of follow-up, we looked into patients that had incident coronary artery disease, and we looked at differences between PCSK9 high and PCSK9 low patients, and we corrected for LDL receptor and LDL proteins and age and smoking and all those co-founders, and we found 287 differently regulated proteins between the high population and the PCSK9 low population. So with these proteins, we did a pathway enrichment analysis, and interestingly, we found, for instance, differences in pathways that were related to cell surface interactions at the vascular wall and blood vessel morphogenesis. To study this in more detail, we are interested in vulnerable plaques. So vulnerable plaques are characterized by, for instance, intraplaque hemorrhage. This is the case in coronary artery disease, as you can see on the left side of this picture, but also in accelerated atherosclerosis in vein grafts. So why do we think this intraplaque angiogenesis and intraplaque hemorrhage are really important for unstable lesions? And that is a result of that these neovessels grow towards hypoxic region. This is a normal biological response. However, in the case of atherosclerosis, these neovessels don't develop properly, so they often lack pericytes coverage on the sides, resulting in leakage of these neovessels, and the leakage of both the red blood cells, which contain a lot of cholesterol in the plasma membranes, or the influx of immune cells from these leaky neovessels can accelerate atherosclerosis. So we use, to study this, we use the Murine vein graft model, and for this we interposition a caval vein from a donor mouse in the carotid artery of a recipient mouse. Immediately after surgery, it looks like this, and within 4 weeks' time, we see a completely remodeled vein graft with atherosclerotic lesions if we use an atherosclerosis-prone mice, and as you can see over here, neovessel formation. So if we use a wild-type mice, we see a thickening of the vessel wall in 4 weeks, which consists mainly of smooth muscle cells and fibroblasts. But if we use atherosclerosis-prone mice, and in our case, we often use the ApoE3 Leiden mice, which has a normal cholesterol level of metabolism, but they also have a defective ApoE3 gene, a human ApoE3 gene that causes familiar hypercholesteremia. These mice have increased cholesterol levels, which result in, within those 4 weeks of time, in massive lesions that contain intraplaque angiogenesis and intraplaque hemorrhage, as you can see over here. So we've also demonstrated this with immunohistochemistry. So in these mice, in these lesions, after 4 weeks, we really see here in red these microvessels throughout the atherosclerotic lesion and vessel wall. And as you can appreciate here in green, some of these neovessels, you can really see the erythrocytes inside these vessels, but we also see a lot of these erythrocytes outside of these neovessels, demonstrating that these neovessels are leaky. We've also demonstrated this in vivo using confocal imaging. So we injected these mice with two different forms of dextrans, a 2000 kilodalton Fitz-dextran that mostly stays in the vessels, and if we have leaky neovessels, the 40 kilodalton Tritz red dextran would leak out. Let me see how I can start the movie. So now I will skip that part. So what we can see in these mice is that these leaky neovessels in the plaques show much more leakage than fenestrated microvessels in the salivary glands or the continuous microvessels in the ears of these mice. So here you can appreciate how we do the ultrasound analysis in these mice. So we do long axis measurements. As you can see here, we use the Fevo 3100 system. And here you can see a beam mode image of 7 days vein graft, where we can really see straight bypass. And after 28 days, this bypass is quite tortuous. It's remodeled and the vessel wall is thickened. We also do a lot of measurements on the short axis, as you can appreciate over here. So here we have the vein graft, where in this Doppler image you can really see the turbulent flow. And we can we compare these. Originally, we mostly do endpoint stainings, where we can do two-dimensional area measurements. So we can measure the lumen, the wall, and outward remodeling as a combination of the lumen and the wall area. But using the ultrasound imaging, we can now also do these measurements in real time, non-invasively, and over time, as you can appreciate here. So in this case, we compared wild-type mice with the ApoE3 Leiden atherosclerosis prone mice, and you can really see that over time, we see a massive increase in the vein graft wall area. So we can go from those two-dimensional areas to three-dimensional areas, as you can appreciate here, and you can very well see the turbulent flow that occurs in these venous segments in the arterial circulation. And we can quantify this and make volume reconstructions, as you can see over here. We also use photoacoustic imaging, and as you probably already know, but I still explain it briefly. So using a laser input, you get absorption in tissues. These specific components give thermal expansion, and that can be picked up with an acoustic ultrasound transducer. So there are a couple of chromophores that have natural ability to have photoacoustic abilities. And if we look at the vessel wall, we can see that this includes lipids, elastin, collagen, and hemoglobin. And all what is also very important in these measurements, if you want to do in vivo measurements, is that in the skin you have a lot of melanin that also has these photoacoustic properties. In a study we performed, we looked at specifically the NEO1 spectral library. this is the region between 680 and 970 nanometers. And we looked into these vein grafts at 3 different locations, and we acquired these profiles from these mice, and which looks quite nice, but quite complex. So how do we get something useful from these spectra? So for this, we used the unsupervised superpixel photoacoustic unmixing, the SPEC system that was developed by Valeria Grasso at Visual Sonics. And besides unsupervised mixing, you get fluence correction and a combination of enhancement of weaker absorbers. And then with this, you can compare known spectra with the unknown spectral profiles you get from your photoacoustic imaging. And by using cross-correlation analysis, you can get you can pick out these known absorbers as shown here. And with that, we could see, for instance, collagen, lipids, oxygenized and oxy and deoxygenized hemoglobin in our vein grafts. So to be sure that we have the proper quantification of these components with these non-invasive in vivo photoacoustic images, we validated this with histology. So for the collagen, we used Sirius red. So on the left, you can see the Sirius red on the histology sections. And here on the right, you can see the photoacoustic signal. And if we quantified it, we saw comparable levels between the photoacoustic and the histology. And we also did this for the lipids or the fat. And for that, we used the perylipin-1 staining. And also we saw comparable levels between the histology numbers and the photoacoustic numbers. So for the PCSK9 inhibition study, we of course had the hypothesis that PCSK9 inhibition has more effects than only the cholesterol lowering effect. So pleiotropic effects that can be useful for preventing vein graft disease. So from the biobank, we saw that high levels of PCSK9 are correlated to cell surface interactions and blood vessel morphogenesis. To study cholesterol independent effect, we have to study it on top of cholesterol dependent effects. So if you're probably familiar with the most common ApoE knockout and LDL receptor knockout mice, these mice have defective cholesterol metabolism, so they don't respond to statins or PCSK9 with cholesterol lowering. However, this ApoE Leiden mice has its own functional cholesterol metabolism, and on top of that, defective metabolism. So as you can see over here, they do respond with cholesterol lowering on top as a result of statin treatment. So in our study, we did a comparable strategy, but instead of statins, we used alirocumab, a PCSK9 inhibitor. To control for the cholesterol lowering effects and the PCSK9 cholesterol independent effects, we had the following study setup. So we had 3 study groups where we fed one group of mice in high-fat cholesterol diet, and we gave them control antibodies, as the alirocumab is an antibody treatment. The cholesterol study group, the mild cholesterol study group, showed only the reduction of the cholesterol and in comparison to the high cholesterol diet. And so we could study the high cholesterol diet with the PCSK9 independent effect by comparing these mice with the mild cholesterol diet group. We also performed ultrasound analysis on a weekly basis, and at the end point we also did photoacoustic imaging. So how does this look like on cholesterol lower effects? So here you can see that the high cholesterol diet group has quite a high plasma cholesterol. The mild cholesterol diet group has plasma cholesterol levels around 10 millimolar, and also the high cholesterol diet group with PCSK9 inhibition has comparable cholesterol levels as the mild cholesterol diet group. So we looked at the effect on vein graft remodeling over time using the ultrasound analysis, and over time we didn't see much differences on the luminal area, but we did see an effect on the vessel wall. So the PCSK9 inhibition group showed a comparable lowering as the cholesterol, mild cholesterol diet group. When we compare this with the histology, we saw comparable values where we indeed saw a significant reduction in vessel wall area upon PCSK9 inhibition comparable to regular cholesterol lowering. But what about the lesion composition? So we used the photoacoustic imaging to look at the lipid profiles and the collagen profiles in these mice at the end point, and we saw with the photoacoustic imaging that we have a reduction of lipids in these upon PCSK9 inhibition comparable to the mild cholesterol diet group. And we didn't see much differences on collagen levels, which we could confirm with histology. So we also looked at other components in the vessel wall, such as smooth muscle cells and macrophages. And here we could appreciate that we didn't see any differences in smooth muscle cells, but again, we saw a decrease in the macrophages in the PCSK9 group comparable to the mild cholesterol diet group. Since macrophages are only one form of inflammatory cells, we also looked at the total number of leukocytes that were infiltrating in the vessel wall, and we could see that we had a significant difference compared to the high cholesterol diet group with PCSK9, whereas this difference was not significant in the mild cholesterol diet group. So these effects of these immune cell could be seen as a form of cell surface interactions at the vessel wall, which we found in the UK Biobank. But what about the blood vessel morphogenesis? To study the effect of PCSK9 on angiogenesis, we performed an aortic ring assay, and we saw that up on PCSK9 inhibitor, we saw an increased number of sprouts in these aortic rings. And when we looked at the quality of these neovessels, so at the coverage of pericytes using the ACTA2 staining, we could see that PCSK9 inhibition increases the number of pericytes around these sprouts. But how can you monitor this in vivo? So for this we could use the oxy-deoxy hemoglobin measurements using the PA function. And ideally, we use this on top of the ECG-gated kilohertz visualization, as you can appreciate in this picture. So here you can see how these the vein graft is monitored throughout multiple cardiac cycles. So you get a slow motion movie of the the tissue of interest. And on top of that, we can perform the oxy-deoxy measurements, as you can see on the right picture. So we quantify this in these three groups, as you can see on these images. And interestingly, we saw, especially in the PCSK9 group, that we saw, had an increase in oxy-deoxy signal, which is clearly significant compared to the high cholesterol group. And from that, we can calculate the oxygen saturation, or we can calculate. That's what the FAVO lab program does. And we saw a significant increase in both compared to the high cholesterol group and the mild cholesterol group. We also studied this on histology, and for this we used the tissue clearance method and with confocal imaging or light sheet imaging. And here we could really appreciate the neovessel 3D structures. And upon quantifying this, we could see that we have a significant increased number of neovessels in the PCSK9 inhibition group, and that these neovessels also on histology show more pericyte coverage, so less or more mature neovessels. To study these neovessels more specifically using photoacoustic imaging, we labeled anti-endoglin antibodies that specifically can image activated endothelial cells with 800CW. And as you use these labeled antibodies, it's really important to make your specific profiles, because labeling of a photoacoustic marker like 800CW with a antibody can cause changing of the photoacoustic profiles of these markers. So we performed made first a profile which we loaded up into the FAVO system, and with that we could we tested this on endothelial cells, and in this case we incubated endothelial cells with TNF-alpha to make the endothelial cells more activated. And indeed, up on this TNF-alpha stimulation, we could see the labeling of the photoacoustic in this case, we used fluorescent imaging, because 800CW also has fluorescent properties besides the photoacoustic properties. So using this system, we could indeed confirm that labeling of the 800CW to the anti-endoglin antibodies was successful. So next we use this for the in vivo imaging. So we injected mice at the 28-day time point with the endoglin combined with the CW800 and performed the photoacoustic imaging. And we used the spectral mixing using the loaded profile to look at the activated endothelial cells in the vein grafts. When quantifying, and we measured at various time points, so 15 minutes after injection, 4 hours after injection, and 8 hours after injection. And especially at the later time points, we could clearly see that we have an increased signal of these endoglin activated endothelial cells in the PCSK9 inhibition group. So we also validated this on histology. So comparable to the light sheet analysis, we could see an increase in neovessels, and we could see more mature neovessels due to an increase in ACTA2 coverage, as can be seen in red over here. But we could also compare this with the extravasated erythrocytes. And if we quantify this, we really could see that PCSK9 inhibition showed a significant decrease of interplaque hemorrhage in comparison to the mild cholesterol diet. Why is this interesting? Because most of these interactions of neovessels with immune cells in the surrounding is related to the combination of integrins on the leukocytes and adhesion molecules like VCAM and ICAM on the endothelial cells. So we studied this in more detail. So we stained for both VCAM and ICAM, and we quantified both the ICAM signal and the VCAM signal, and we could really see that the PCSK9 inhibition resulted in reduced VCAM numbers and barely not significant ICAM signal in these PCSK9 treated animals. So as you can remember from previously, we saw that we have a significant number of CD45 leukocytes and macrophages, but this was not cholesterol dependent. So we looked into another form of leukocytes, and that is the T cells, because they really connect with the FLA4 receptor to the VCAM integrins. And what we did here is that we really used the CD31 positive neovessels, and we looked in the close surrounding of these neovessels for staining of CD3 positive T cells. And we could see that we saw a clear effect from the PCSK9 inhibition on these infiltrations of CD3 in the tissues of these of the vessel wall, in the vein graft wall. As you probably can remember, is that these mice that got this PCSK9 inhibition treatment, they had an increase of plaque angiogenesis. So if we compensated for the increase in angiogenesis in the PCSK9 inhibition group, we still saw this reduced number of T cells in the surrounding near the neovessels. So to summarize, we can see that using the UK Biobank, there are, if we compare PCSK9 low and PCSK9 high expressing patients, there are specific cholesterol independent pathways like blood vessel morphogenesis and cell surface interactions that can explain the differences in PCSK9 inhibition. And if we use PCSK9 inhibitors, we could see a reduction of the vessel wall, a reduction of the amount of macrophages in this vessel wall. We see an increase of vessel wall oxygenation that was related to a decrease of leaky neovessels and a decrease of intraplaque hemorrhage. And this was not only the leakiness of the red blood cells, but also we saw a reduction of leukocyte extravasation, especially T cells, as a result of reduced VCAM expression. So based on this study, we could think of that PCSK9 inhibition could be very beneficial to prevent, to increase vein graft patency and prevent vein graft failure. I would like to thank you for your attention, and I would especially acknowledge my team, and especially for this study, Vincent Sier did most of the work together with Vardin, and but also Cayley and Alwyn and Valeria and Gayatri from Fujifilm Visual Sonics did a lot of work on the specs analysis. Thank you for your attention.
Thank you very much for this nice presentation. The audience, please make good use of the Q&A button, because I think we can now move to the discussion parts. I will open the questions for you. There's one question about the model itself. Can you comment on any challenges you encounter imaging animals post-surgery? Does the scar tissue get in the way? How do you work around that?
In relation to imaging?
To imaging, yeah.
Yeah. So we do see that if you image these animals and one day after the surgery, there's indeed a lot of fluids and that can interfere with the imaging. So what we do is we image quite directly after the surgery for the first time. And regarding the scar tissue, that's the nice thing with ultrasound imaging. You can have different angles. So we image these mice in such an angle that we don't image the scar tissue. So we really image from if the scar tissue is on the front, we image the vein grafts from the side. So we don't have that much effect of the scar tissue, but we do see edema formation really can affect the imaging after the surgery itself.
Thank you very much. Well, I think this highlights nicely the flexibility of the imaging setup to work around that scar. Another question is, if you could please re-explain the difference between the ApoE and the ApoE Leiden.
So the ApoE has a defective cholesterol metabolism because the ApoE is disrupted, is knocked out. The ApoE3 Leiden has its own just normal mouse cholesterol metabolism, but on top of that, it is a knock-in of a human defective gene. So the human defective gene causes the cholesterol, the familiar hypercholesteremia, but since it still has an effective cholesterol metabolism, the statins and PCSK9 can effectively work on reducing cholesterol levels.
Right, thank you. Scrolling through, there are several congratulations to the presentation. Excellent content. Really like to pass it on. Another question is, do you always have to validate your ultrasound data and photoacoustic data with histology?
I hope in the future we don't have to do so. But since this is still a new technique, we think it's really important to keep validating these results. We've now published a couple of times the ultrasound data and the histology that there's really a good correlation between those. So hopefully we now can move away from these endpoint histology and can, for instance, do transcriptomics on these endpoint samples and use the ultrasound imaging and together with the photoacoustics as quantifying a lesion composition. But for now, often reviewers ask for validation with the gold standard of histology.
Thank you. Another question is, okay, first a comment, very nice model of the vein graft. Can you comment on the changes, the timeline of changes, especially how early will you be able to detect small subtle changes?
So now we have a long-term experience with this model. So we have over the years, we have done a lot of different time points. So we know that in the first couple of days after the interposition of this venous wall in the arterial circulation, you get a lot of turbulent flow, and the surgery itself causes endothelial damage. So you have fibrosis in the first couple of days, and a lot of cell death. And then from 7 days on, you get a very fibrotic wall that slowly builds up until this either a smooth muscle-rich wall, if you use the black 6 mice, or this atherosclerosis prone lesions when you have these when you use the atherosclerosis prone mice. And that can be an ApoE knockout or LDL receptor knockout, or an ApoE3 Leiden mice, that the lesions look quite comparable, but they have different effects when based on statin or PCSK9 inhibition. And we do see, especially now we use these ultrasounds, that up on these treatments, we mostly see the effects from 3 weeks on. So first you have a lot of infiltration of immune cells and fibrosis, but most treatments that we've tested are affecting cells like the smooth muscle cells, and that's something you can see from 3 weeks on, and that's why we really value the ultrasound imaging over time.
Great, thank you very much. Another very interesting work, because you look into different parts of different components in the vessel wall. Can you go even smaller, and can you detect different types of lipids? I guess this relates to photoacoustics itself.
Yeah, that's an interesting question. The resolution is unfortunately of the photoacoustics is not that strong as using the ultrasound itself. So we, although I think the new system is even better, of course, than the Laser X that we used. But interestingly, we have used the system to look at brown adipose tissue and white adipose tissue, and those clearly show different profiles. But looking at the vessel wall itself and really see differences between lipid components, I don't think that's doable right now.
Okay, thank you. You reported and showed vascular leakage with the microscopy. Is it possible to do this with in vivo imaging as well?
Yeah, that's something we really would like to look into, but and I think the oxy and deoxyhemoglobin could be useful for this, but we really have to look into what the effect is of leakage and the signal that is provided based on the oxygen and deoxyhemoglobin levels, and the signals that healthy neovessels show. I don't know if I'm clearly explained myself. So you get a overall signal throughout the vessel wall, but we were not able to distinguish the signal in areas where we have a lot of leakage of erythrocytes, or in more healthy ones. So how does this relates to the oxy and deoxy signal? Yeah, that's something we really would love to look into.
Great, thank you very much. Well, thank you, Dr. Vries, for a nice presentation and going in depth for the questions and answers. I think we've answered most of them. There are more. Congratulations on the presentation. Thank you for the attendees for attending, watching the webinar, asking the questions. Recording, as mentioned initially, will be made available for you. And with that, I'd like to thank you for attending. Thank you, Dr. Vries, for presenting, and have a continued nice day. Bye.
Thank you.